challenge we have is basically in the areas of data. In areas of information technology, we don't have end-to-end processes. And this is the biggest challenge that we have. And it's good if we can get now solutions in that space on how to have end-to-end processes. Because number one, in our levels of healthcare, now we start from the primary level to the highest level possible. We don't have that connection. If a patient is referred from the community level, we cannot track that patient in that process. Number two, we have challenges in terms of what we make in terms of diagnoses and how to ensure that if a patient has been seen in facility A, if he goes to facility B, that can be tracked. So these are some of the challenges we have, including the challenges we have in the food space, in terms of public health, in terms of how we track those who handle food, in terms of how we track those who have expired certificates in that sector. And in that space, we have that big challenge, including what happens in our mortuaries. You know, we have the biggest facility in terms of mortuary, a city mortuary now called Nairobi Funeral Home. And the biggest challenge we have in that facility is that we are not able to have like a profile of the all bodies we have in that facility, how they live, how we identify unidentified bodies, and ultimately inform their families. So these are some of the challenges we have in that sector, and it will be glad that we hear the innovation in that space and what can be done to solve those challenges. Thank you.
Thank you so much. And Dr. Irene, maybe more specifically, what gaps do you see in terms of provision of care which can be addressed using innovations?
Okay. Wow, that's a big one. First of all, in terms of care, when I look at how I look at this is in terms of the health pillars. Financially, it will affect the quality of care. We have a lot of problems in, challenges actually. Let me call them challenges when it comes to adequate financing of healthcare services. Again, we're looking at human resources for health. That's a big one. In fact, currently, that's one of our biggest issue in terms of human resources for health. Again, in terms of infrastructure, struggling with obsolete equipment, and also infrastructurally, we need to also have to renovate even our structures, the facilities, the health facilities. In terms of service delivery, we still are not there when you talk about access to good quality care. Our problems they are quite intertwined. Our challenges are quite intertwined. Also, we have challenges in terms of having enough or adequate health commodities. So when I look at all these aspects, health has quite a number of them, but there are areas, I keep saying we look at gaps and convert them to opportunities that can be exploited to make our services better. Thank you.
Thank you so much. And in terms of innovation, what did you say some of the things the county government is starting to do or is doing at the moment to make it easier or more conducive for private innovators to collaborate with the government?
We're embracing public-private partnerships. I had alluded to something we're working on in terms of innovation, where we want to have an app that can help our mothers in the community. And the reason why we're looking at mothers is because of maternal mortality rates. Maternal mortality is a very big indicator of performance. We must minimize that. So because of that, looking at the variables that actually contribute to maternal mortalities, that is one of the areas of intervention that we require to ensure that we're not losing our mothers. We need to do everything that is possible not to lose our mothers, especially when they're bringing life into the world. So one of our innovations is in that space. And in fact, we've had this discussion with, at Mbagathi Hospital so that we're able to track them and also ensure that they visit the clinics, and also at the time of delivery, we're able to ensure that they actually get to the facilities. And again, at the moment, we have what we call primary healthcare. So we are currently, as Nairobi County, working on what we call primary healthcare networking, so that we're able to strengthen our tiers of health, we have 6 tiers. We have level 1 up to 6. So level 1 is community, level 2 we have dispensaries, level 3 we have health centers. Then now level 4 are the upper level hospitals, where we have the specialized hospitals as we escalate to level 5 and 6. Level 6s are hospitals that are managed under national government. But at our level, when we strengthen the lower levels, it will help us to be able to actually start improving the quality of care that we're going to give our clients.
Thank you so much. And I think now we do have some twin innovators in the, on stage right now. So maybe I'll start with you, Priscilla, for Maziwa. If you can tell us, what has your journey been like, building a business, innovating around healthcare solutions? Like, what has your journey been like? What are some of the things that you've learned along the way? What are some of the challenges that you have come across? And what would you say to someone else who is watching us live, or someone in the room who is thinking about building a healthcare business or health tech business?
Okay, to be fair, I joined Maziwa last year in October, so
Okay.
I was not there from the beginning, but I have a bit of insight around what happened a couple of years back. So Maziwa was started in 2016, and Maziwa was the first e-pharmacy, and at that time there was no regulation around e-pharmacy. So the challenge was the regulation, and the good thing is that we worked closely together with PPB to come up with something that makes sense both for the consumer and for the business. So that's what I would say was the biggest challenge at the very beginning, because we would end up doing things and we are not sure whether it's within the law or not, and there was no guideline to help us with that. But we finally managed to figure out something that makes sense, and now we are seeing more and more e-pharmacies coming up because of that. So the challenge was that, but the other challenge was the uptake from the customer side. Just having that trust that medication can be delivered to you at your home was a challenge. But COVID is something that helped us it sparked growth at Maziwa, because we saw more and more people embracing technology, or rather embracing the fact that they can get medication delivered to them. And we've really grown ever since COVID, and we've incorporated other services like I was talking about, telehealth, and we are seeing more and more people coming in. So if I can speak about telehealth, what we are seeing is that people are coming to us to help them manage their chronic diseases. So we saw that 90% of the people coming to book a consultation, they're coming to do a follow-up. So the gap we are seeing ourselves filling is, we are not going to replace the specialist you go to, but in between your specialist visit, Maziwa can work with you, because we have doctors in the office who can call you on a monthly basis to just follow up and make sure you're adhering to the medication, and also advise on a couple of lifestyle modifications you can do. And now when you're due for your specialist visit, you do your proper analysis, or rather diagnosis, and we continue the journey with you. So yeah, those are the challenges, and that's how we've been able to solve some of them. Yeah.
Thank you. I'll come back to you later on that. I want to hear from Aaron, on Damusasa. Like, what was the inspiration behind setting up Damusasa? Like, what have you learned along the way? Have you worked with the government or the public sector? How's that coming along?
In terms of the inspiration for Damusasa, that was mostly due to the Westgate attack. That's where our genesis, actually, the idea of Damusasa begins. And it was more so because the scenario that was witnessed was where victims of the attack ended up as patients in different hospitals. But because the hospitals and the entire ecosystem in general was not expecting such a sudden shock, we had low availability in terms of blood products, blood bags, reagents required to screen the blood products. And the idea became whether we could have a platform or a way in which hospitals, for example, which were outside Nairobi at the time, who had readily available blood products, if there was a way for them to interact, collaborate, share those products, shorten the lead time for patients to get blood, and that's how the Damusasa was built. In terms of government support, Damusasa arose from the Presidential Digital Talent Program under the Ministry of ICT, where we were incubated. And through that, we were able to pilot the solution at the Kenyatta National Hospital. And I would say, in that respect, we've received government support. Of course, as my colleague said, there are challenges, especially when it comes to policy. And most times, policy and regulations tend to bar innovation, because innovation, especially if you're talking about AMSASA, where we're dealing with a medical product such as blood, that is one side highly emotive. On the other side, it's a highly private affair in terms of the data that is obtained from blood products and services and blood donors. And sometimes innovation can be stifled, especially innovation such as ours can be stifled by the regulations that exist. However, sometimes you find that the value that the innovation is bringing is so much that regulation comes in, or the people who regulate actually come in to work with you to see how best the innovation can survive despite some of the flaws in the regulation that would be pitfalls for the innovation. I would say also that Damusasa, where we are right now, I think we're in close to 180 hospitals across the country, serving about 38 counties, and now in 2 other different countries. And had we gotten the government support to the level we expected, probably would be much further along, not only in terms of revenue, but mostly impact. Because since our inception, we've been able to help save close to 40,000 lives plus. And had we gotten that kind of support, especially when it comes to scale, I think we would have been further along. I welcome very much the idea of PPP and the fact that now innovators and startups can begin to use that channel to partner with government, because you find most times it's an innovation, which means there's very little competition. So when you do an open tender, innovators get killed by the big boys and girls. So when we have such an arrangement where even the smallest startup can actually get their services bought by, like the county government of Nairobi, I think that's the way to go for the health tech ecosystem in Kenya. Thank you.
And in terms of the regulation, like what did you say? Would you say it's gradually improving, like where we at? What do you feel about the environment now? I mean, a few years down the line, like what do you feel about it now?
Like I said, when we started, I think PPPs was not really a thing for us. This is something that I've really started to hear, or rather has been championed a lot, I think in the past maybe 1 or 2 years. And it was really hard for us in the beginning because one, you want to sell your services to a big public hospital, but then you find that this may have to go to open tender. And usually when it goes to open tender, you have challenges as a small company. So you find it even affects your pricing margins, because you have to think what price level should I charge to ensure that this doesn't go to open tender, which not only curtails your revenue, but also curtails your growth. But now when we start talking about PPPs, you find that PPPs can be signed with government and funded by other parties, which now makes it a bit better for innovators and startups in the room for growth. And I think the dream really should be, how do Kenyan startups grow, supported by government, to even other countries, giving solutions to other countries, that are bordering Kenya and in Africa as well.
Thank you so much. And Tom, coming back to you, we keep saying PPP here, and maybe you'd like to spend a minute or two just talking about PPP, like what's the whole idea, and how do you think it's going to change how things are working and make it easier for innovators to work with the government?
That's a very good question. The big picture behind PPP is because, one, is the funding we have most in the county government. In this case, I will talk of the health sector. The funding we get in the health sector is not in tandem with the needs that we have. Like through the Abuja Declaration, we said that government should put 15% of the top budget to health. But if you calculate what we get to health, is way I think we got 4% from the current budget in the county government of Nairobi. So that means we are not able to cater for all that we need to cater that space. So we need to come up with the public-private partnerships to ensure that when you bring your innovation, we are able to come in as the county government, maybe we give you the space required, then you bring in your innovation, then we cost share. We see that how best can you benefit as the innovator, and how can we benefit as the county government. So that's what we are majorly considering it, and we are doing very good work in the space of radiology, in the space of lab equipments, that someone can bring the equipment to our labs. We agree on the percentage they will get. We agree on the service our people get, because as the government, our major focus is on the service, not actually the money. Once our people now get the service, we ensure that these machines are going to be serviced by the provider, and this is the benefit they want to get. So through that, we are able now to fund our healthcare systems in a manner that now we can meet the demands as needed. In another area, which is very interesting and is something I will now arrive to talk at this moment, is the area of artificial intelligence. Because we have seen area like in radiology, I think we have seen those innovations in the area of radiology, whereby if a CT scan has been done from some particular hospital in the city, it can be sent to a particular place where it can be interpreted using artificial intelligence, and you get the result in real time. I think these are some of the innovations that are changing the sector, and we welcome more of those so that we can provide real-time solutions. And as a county government, we are committed to ensure that we bring all the innovation on board, and I thank the Chief Officer for Innovation, my counterpart, Victor, for now bringing this space and ensure that we are working together. More so in the area, even on the food space, we're working the World Food Program. They have an innovation team which are coming up with very good solutions in terms of how do we test like mycotoxins in foods in real time in our markets to ensure that food is safe for the public. So we welcome all these on board, and we want to give a platform actually. I would like now to have, maybe from here we move now to the Health Innovation Week, so that now we see the innovations in the health sector and exactly what the private can do to help now the public hospitals even do much better. From starting with the staff, and this is the biggest problem we have, that we have staff who some don't go to work. We have actually the best minds, some who spend most of the time in the private hospitals. We want to ensure which technologies do we bring on board from the private sector to ensure that we can map our healthcare workers where they are with the GPRS system, and which can show us exactly the output of the same healthcare workers, what they are doing in terms of customer satisfaction and the output they are giving in their respective areas, so that we are able now to map and say these are the number of healthcare workers we need, and this is what they are doing in our spaces. So in terms of PPP, we encourage that all these innovations now we get a tech week with the health sector, so that we can see what is there in terms of from HMIS, Health Management Information Systems, which can track all this, so that we can have a one-way, which I said in the beginning, where we have hand-to-end in terms of what we can do from the patient, from the start to the end, and how we can manage our human resources and the technologies that we have. So this is a space we encourage, that once we have technology, like in the food sector under the public health, we are going to engage a PPP in terms of food safety in the city. We give a space, you come with your innovations and technologies, then we agree on how we benefit as a county government and how you benefit as the innovator. Thank you.
Thank you. And what do you feel about the awareness and the adoption of this PPP framework? Do you feel like the private innovators are aware of this platform, and what are you doing as a government to take it out there for adoption? I
think this is one way. Whatever is happening here is one way we are now putting to advocacy and ensure that now the public understands, more so the investors and the innovators. I know we have not done much, and most people don't even understand how PPP works with governments. I know there's a huge gap in that space, but through such forums and many others which we are ready to engage in, I know we can cross that gap and ensure that now people understand that you can come with your innovation, it's secured, and you can benefit from it, bringing the real-time solutions, and the county government will benefit, and the people we are supposed to serve equally benefit. Thank you.
Thank you. And now to you, David. Maybe just take a minute and tell us about AIC. What do you invest in? What kind of tickets do you fund? What do you look for what your deal preference is. Like, just tell us a bit more about AIC generally.
Yeah, sure. Thank you. So as I mentioned during the intro, so AAIC in full, it stands for Asia, Africa Investment and Consulting. So we started our company or firm back in 2007, and we began as a management consulting firm back in Japan, Tokyo. And we focused mainly on management consulting for a lot of the big Japanese multinational companies that you might know of, Toyota, Mitsubishi, and the likes. And so up until 2013, we were doing mostly management consulting, and we decided to pivot into a bit of investment management as well, because we saw a lot of solutions, not just mainly in Japan, where a lot of the companies are struggling to get to the next level, and yet you could see what the idea that they had was very, very robust. So we started seeing how we could venture into investments, and in 2014 we managed to we got the chance to manage our first investment fund on behalf of Toyota. And so we managed it for about 2 years until 2017, when we decided to look for investors by ourselves as a company and start investing money directly on our own. And so in 2017, we established our first fund. And so the first fund was $47 million in size. And so we deployed this money not just in Kenya, but across Africa. And our main investment criteria, we were looking at the healthcare space in Africa. So the idea, like I mentioned, was to try and make healthcare a better industry, just to make the healthcare outcomes a lot better in this area. And the reason we're focusing on healthcare again is because our majority of our investors are equally healthcare players, multinational players in Japan and across Asia. And so even they would want to come into Africa and change their healthcare outcomes, and that is the reasoning as to why we invest in healthcare. And so we typically look at healthcare companies, both brick and mortar facilities from the clinics. Also we look at tech companies, for example, like Maziwa, which is one of our investments. And so what we ideally look for is we just look for one, a solution which has actually happened before, something that's been done before in a lot of maybe like the developed markets, for example, and something which we can borrow and bring here in order to try and also better our own outcomes. So we just try to see what areas within the healthcare space need this funding, and try to identify what companies are trying to offer solutions with that space, and then see how can we work with this company, not only by just investing, but also what follow-on support you need from investors. So in a nutshell, I would say that's what as AIC we do.
Thank you. And what's your experience working in the early and growth stage, like investing in the early stage healthcare businesses? Like what are the learnings you don't share about that?
Yeah, that's a good question. Of course, there's been a lot of learnings through the years. I think I've worked within this investment space for 5 years now, and I think one of the key learnings is that technology is not here to replace the current solutions. Technology is only here to enhance the current solutions. So there has been a very big, I feel like, disconnect where people believe that we should just come and replace the hospitals that were existing before. But that's not the case, because if you look at how our culture is as Kenyans, is we want to go to the doctor, we want to be seen by the doctor and receive the diagnosis from the doctor. And so telling me to go through, say, a Zoom call to speak with the doctor, you see, I'm not used to that. And so I think the biggest lesson has been that it's that technology is not here to replace, it's here to enhance. And so if we can use technology to identify maybe some of the shortcomings within the industry, say for instance, as Thomas mentioned, the data flow from hospital to hospital, we need to understand what is causing that issue, and then how can we use technology to solve that particular issue, not use technology to replace the entire system. So I would say in terms of the lesson, I think that's the biggest lesson. Technology is here to become our friend and not to take our jobs. Yeah.
Great. I know you look at so many opportunities every day when you're looking for deals, and I know that you invested in Maziwa, for example, and the question is, what were the early signs that you saw that led you to believe that it could be a successful business?
Yeah, so for Maziwa, I think we began conversations as early as 2018 when they were just about 2 years old. And I think for my DAWA, the first thing is we noticed that they are operating in the e-commerce space. I think e-commerce, everyone will know of Amazon, for example, and so already that's the first thing that spoke to us. They're looking to innovate within a field where we've seen very big successful companies. In Africa, we had Jumia, which was the first sort of big e-commerce company. And so that for us was the first thing that piqued our interest. It's the fact that they're using technology. And then secondly, we also wanted to see how, or rather what we saw was they not only are within the e-commerce space, but they have dug a bit deeper and they have gone into the healthcare space. And we could understand that one, healthcare, when you look at government funding and when you look at the national budget, healthcare is one of the industries which gets one of the biggest portions of the funding. And so we could see that indeed the government is also thinking about how to continually better healthcare outcomes. And also that was another strong reason as to why we decided to, rather we looked at my DAWA. And so initially we didn't know that they would be successful. I think the thing is you have an idea of what you need to do to get the company successful. So it's not just a matter of implementing a lot of these ideas. And so, I mean, once we looked at the fundamentals, we look at the team that was there, we liked the team. You look at how they're approaching to solve the solution, we liked it equally. And so we decided that we can take this risk. We can try to work with them and we can try to borrow some of the key success factors from companies like Amazon or Rakuten, which is in Japan, and try and see how can we replicate these key success factors to try and create a company which will equally be of such magnitude as the other successful e-commerce companies across the world.
Thank you. And to Priscilla, what did you say has been the experience working with a VC? Like how has that helped my DAWA on the growth path, working with a private investor?
I think AIC came in when I was not there, but from my understanding is that we needed the push to take the business to the next level, and they came in at a very good time. Where we needed to scale just before COVID. And working with investor, I think if you're an entrepreneur and you're looking for an investor, it's not just about the money, it's also about the strategic partnership you can have with the investor. You can even look at their portfolio. For example, I also work very closely with the AIC because they have a network of hospitals and we already have our own drugs that we manufacture, so we can supply these drugs to these hospitals. So you look for synergies within the portfolio, and that has really, really worked well. So as an entrepreneur and a business person looking for investment, don't just go for the money, but look also at the opportunities that the investor brings in.
Thank you. Aaron, we are talking about investments and working with investors. I know Vilgro has invested in Damusasa, for example. What has been your experience? Like, how's your partnership with Vilgro? What have you learned in the process? Has it been beneficial to Damusasa? You can talk about that a bit. Yep.
Yeah. So when you're an innovator, sometimes it becomes very difficult to become an entrepreneur. So those are two different things, but mostly are mistaken to be the same thing. Innovators know how to create solutions to problems, but then entrepreneurs know how to make those solutions business worthy and grow them as companies. And I think as Damusasa, we're coming from a position of innovators. So being privileged enough to secure early stage investment from Vilgro was quite beneficial for us, not because of the capital that was injected into Damusasa, but also because of the kind of talent they had at Vilgro, the kind of insight they had at Vilgro in order to enable us now to start seeing the solution we had created as a potential business, and how we go to market, how we scale, and start looking at the space not just as a Kenyan problem, but also as a African problem. And working with Vilgro has enabled us such opportunities, not only to propagate our solution in Kenya, but also now propagate our solution across the borders, which I think may not have been possible if we were not working with partners such as Vilgro. And as both my colleagues have already said, when you're looking for investment, most people would want to look at it in terms of the money I can get from the investor, but then you can be given as much money as possible, but without that strategic help, they say this is how you structure your C-suite, for example. This is how you do your business modeling. This is how you acquire talent. You need all that kind of support, and that's what we call, investors who are with you, running the business, not people who give you money and walk away. So for us, I think Vilgro has been such a partner, and I think the other positive is the fact that we've been able to attract follow-on funding as a result of that initial funding we got from Vilgro, which I think when you're looking for follow-on funding is a big plus that somebody took a bet on you, and because they saw potential. So the next investor makes, it becomes easy rather to get the next investor on your side.
Thank you. And David, what do you think the county government could do, for example, to de-risk or to make it easier for you to work with early stage healthcare businesses? Like what can the government do to partner with you better and make it easier for you to invest in early stage?
Yeah, that's a good question. I think if I look at it from the perspective of investors, I think the first thing that investors usually hope for is just an enabling environment in terms of investments, so whether it's going to be some of the regulations around taxation, regulations around capital gains. I think it's a matter of having an environment which will welcome investors, and they will feel that when we put our money in this particular country, then we do not have the fear of we might just lose our money in that country. So I think working with the government, in this case, that would be one of the biggest issues. But I think over and above that, it's also getting to understand some of the very detailed government plans. I think, for example, you've mentioned about how you want to work with mothers and try and track them through the entire pregnancy, from the first antenatal visit up to the final one, and even support them during the immunization stages. So I think if we get to understand a bit more detail on maybe what are some of the key areas maybe the government is really trying to target, because we do come across quite a lot of companies, a lot of startups which also operate. For example, when you mentioned the maternal, I did have a number of, or maybe one or two startups in mind already working there. And so I think it's now just a matter of how can we get to access and work with someone within the government to understand, okay, how this is the area you guys are looking at, how maybe we can present one or two companies and see how can we work better to try and grow this company together. So I think that would really be one of the key areas where if we could have, I don't know, maybe if it's every 3 months stakeholder meetings with investors within the space, maybe we can share some of our stories, maybe we can share some of the companies we've come across, maybe some of the issues these startups are facing maybe. And also equally, like you mentioned, when it comes to the tender system, I think considering some of these startups is equally something that would be good, because once a startup wins such a tender and is paid within a very good time frame, then this startup is then able to hire people who can then, bring the services forth in a quality way. So such meetings would equally be good, where we can also just get to exchange ideas and see then how should we forge forward together. Yeah.
Thank you. And Daktari, we just came out of a COVID crisis a few years ago, and I'm just curious to know, how did the county healthcare system evolve to respond to COVID, and what did you learn, and how did that create opportunities to work with private innovators?
Thank you for that. Wow, COVID, that was big. First of all, how the government, worked on that. First of all, we got a very good system, the e-chanjo. I think all of us must have interacted with it. And it's out of that even we are looking at having very efficient apps to try and tackle our health issues. So that way, just looking at how that worked out, it's still, I would say there's still a lot of areas for innovations, for tech, right? Way past COVID, now that COVID is no longer an issue, but it raised a lot of, it exposed some of the gaps. in terms of even being responsive and also accessing, services, and in terms of moving commodities, for instance. And I'll give a good example. I was here together with my colleague. We were in Kisumu, and we're happy and very privileged to visit their drone technology for increasing access to vaccines and blood products. And it was, for me, just looking at how that worked in Kisumu, reducing the time between which commodities are received at the service, at the facility where the service is being given. That was big. A distance of like 40, that would take 40 minutes. Using a drone would take 5 minutes. So for me, that's profound. That is increasing responsiveness, to emergencies. So there's very many opportunities when it comes to just in terms of innovation in health. Again, I'm listening to my DAWA, Priscilla, here. We have, in terms of managing chronic illnesses, we have innovations on how we check our blood sugars, how we're taking our blood pressures. Now we are moving to using a phone. We are moving away from the glucometers and the blood pressure machines. Just having an app on a phone to test our sugars and actually test our blood pressures, we are actually getting there. So opportunities are many in this space.
I know you talked about the drone innovation.
Yes.
What are the maybe 2 or 3 startups you talk about that you have worked with the county government and you could see the impact on the ground, besides the drone business? Are there any other 2 or 3 that you could mention?
Go ahead.
Thank you. I think that's a very good question. I wanted to respond on the other side of the technologies we had in COVID, but now with the drone. In Nairobi, we had the biggest problem to deal with cholera, and this is where we saw technology help us in terms of cholera mapping and interventions we were making as a county government. Cholera had a devastating impact in our county governments for the last 8 months or so. So what happened, there's a guy who came, and I'm glad that these guys are coming up, and that's the biggest problem we have now with the innovators. Are they ready to showcase what they do before now we can maybe see what we can do as a county government? Because the biggest thing is have this as a solution. As a county government, we want to see which solution is it and how is it going to help us. So this one guy who came with it, something like drone technology, which can capture real images of sewer bursts and what is happening around it and the communities affected. So if we suspect like there's a sewer burst, for example, in Mukuru slums, the drone will be sent there. They will take real-time pictures from Mukuru, and it can show us like this is now the approximate area affected by these sewer burst. These are the people accessing the area. These are the eateries we have around. These are the toilet facilities we have. And these are the interventions we can do as we try to contain the disease. Like that was real time, and I've never seen such technology. So those interventions were real time and would have shown us exactly what we need in that space and what we can do together with innovators in terms of now curtailing the diseases we have. Now to move back to where my counterpart was talking of the post-COVID, and I can talk of now when we started what we call the EOC, Emergency Operations Center, whereby we mapped our ambulances. And now ambulances, we have a partner working with who has mapped the ambulance with the GPRS system. Like if you need an ambulance, we can know ambulance B is in Mukuru slums right now. Ambulance C is near Mama Lucy. So if emergency is around Kangondo Road, for example, we can pin an ambulance which is near to respond to that emergency. So some of those are some of the great interventions we have seen post-COVID, and we are glad now with the innovation of the telemedicine space. What happens that people can consult from their homes, and we have had the good innovations that DAWA can be sent to your home directly without even going to the pharmacy. Some of these things are things we have seen grown in terms of technology. We had a big challenge in terms of how do we manage patient with chronic cases. like patient with HIV, patient with diabetes, because now accessing hospital with COVID was a big threat even to their lifestyle, the disease they are having. And we saw great innovations in terms of they can get a text message that this is the appropriate time you need to come to hospital when we expect maybe the crowds are low, or this is the exact room you need to come at this time. So patients don't have to come and queue. These are the great things we experienced post-COVID, and we are glad that such interventions, and if we continuously work together, we can even do much more in that space. Thanks.
You want to add something?
Yeah, just to add on to what my colleague has said, we also, I've also had a privilege of interacting with the GIS in Vihiga County. I must admit their governor, I think, is a GIS expert, the Geospatial Information System. And that's one space. When I listen to my colleague, I even talk about drones taking real-time photos and giving real-time information at where we have like sewer bursts. That is a plus, an added thing. When I look at combining now the drone technology with the GIS system, having the drone actually sending real-time information back to the GIS system just to help us to be more responsive. Again, we are already in that space for chronic patients who have chronic illnesses. They don't even need to keep coming to the facility. In fact, like now what I talked about, having the readings on the phone, they just take their readings, send to their doctor, and unless we still encourage them to come, but they don't need to come like frequently. So we reduce the frequent visits, so that allows them more time to be able to be more productive and contribute to the economy. So yeah, those are some of the things that we're looking at. So there's still a lot to do.
Yeah, thank you.
Yeah.
I see a scenario where we have a county government looking for these innovators and to learn what they are doing. On the other hand, we have innovators looking and wondering how they can work with the government. So the question is, if I'm an innovator and I want to check with the government, like what does the process look like? If I wanted to know what opportunities exist within the county government, where do I look? How do I get in touch? Like, what's that process looking like?
Just get in touch with Victor. That was on a light note.
If I'm sitting somewhere in a slum and of this innovation I want to sell to the government or to present to the government, do I have to wait for such a forum, or is there a process that I can follow to get to the face of the government?
Not really. In fact, our governor is very supportive when it comes to bringing on board the private sector. Part of his vision, rather, is to have the private sector come on board so that we can work together, because we're working for the same common person, mwananchi, the Nairobian, and beyond Nairobi. You know, they say Nairobi is Kenya. So he's very welcoming. There's no like, I wouldn't say we have like, you have to wait for a forum like this for you to get on board with us. Get on board. You just contact us, come, because in fact, he's the head of partnerships. So
how
all
do I
you
do
need
that?
to do is express yourself and just come on board and just visit us.
Yep.
Or one of the chiefs, like Victor, now being in this space, he's the head of these innovations. So that is a link. We don't have restrictions, you know, when it comes to getting in touch with us. So just come on board straight up.
How do I do that? Like, do I come to your office, or do you go to the website? What's the point of contact?
I think it has been the biggest challenge, and I need to say that there has been a gray area in that space, that we are not able to map the innovators correctly. We don't have a clear communication between the county government and the innovators, and there's been that space where brokers now exploit even the same innovators who are trying to come up, and it has been a big challenge. And that's why I think through the wisdom of His Excellency, the Governor, it's so good that now we have a chief officer in charge of startups and innovation, so that everybody now who has an innovation can be mapped back to there. Now going forward, we have officers from that subsector in our respective sectors. Like in the health sector, we will have an officer for startups and innovation sent from the office of the chief officer, startups and innovation. So through that, now I think we need to work together with that sector, so that once we get an innovator who has an innovation in the health sector, they can now be referred to the health sector to work. But currently we have a huge gap, and people have to come themselves to the respective sectors, which now gives them a challenge. If you don't know how to access respective sectors, then it means your innovation may never take foot. But now we want to make amendments to that and ensure that through that subsector of innovation and startups, each person with a startup can be directly guided, so that if there are startups in the agriculture sector, you can be directed to agriculture sector. If it's in health, you can come to us. We see exactly how is the innovation going to work. And if we are able to maybe to show a few demonstrations here and there, then we are ready to work together and see the best service we can offer for our people.
Thank you so much. And now back to you, David. If I wanted to work with you, I'm an innovator, I want to apply for funding from AIC. What's the process? Like, what do you look for? Like, what's the process? How do I get in touch with you, right? Like, what's the screening process? What's the investment process looking like at the moment?
Yeah, sure. I think, so unfortunately, we operate in a so private investments is usually quite, how can I say, people don't really speak about such investments out loud, so people might not know how to get in touch with us. I think one of the easiest way to get in touch with us is usually through our website. So I think the first thing is to know the specific investor you want to get in touch with. So typically, once you know the investor and the company they work for, then the first place to check is the website. So at the website, well, usually at the bottom, you have the general email address where you can send your inquiries. And so typically, we do get a lot of opportunities that way. We do get people who just send us an email and say, look, this is who we are, this is the business that we do, and we see that you guys invest in such businesses, so would you be willing to consider us for investment? So typically that's how we get a lot of our opportunities that we look at. And I think other than that, it would require for us to have met maybe before, or maybe for you to know someone who's known us before. So mainly through networking. Yeah, and so mainly I would say networking is really the easiest way to get in touch with us. But other than that, at least we have the website where people can get in touch with us. And so even when it comes to the investment process, typically it takes on the minimum 3 months to start from start to finish, where we will look at not only just the business, we look at the market, we want to visit your customers, we also just want to get an understanding of your other stakeholders. Do you have creditors? Who are your partners? And so that entire due diligence process is what will take about, say, 2 months, and then the remaining month is usually more of legal matters. Of course, you have to draft legal documentation. That usually tends to take a bit of time. Of course, you have to negotiate some terms. There's usually a bit of push and pull at that particular point, but at the end of the day, I think agreements are usually come to. So on the very fastest side is usually 3 months, but no more or less, it's usually between 3 to 6 months from the first point of contact to the point where we actually deploy the money into your company. Yeah.
And how much do you invest? Is it debt, equity?
So yes, so we do invest in two main methods. So we can buy shares, so that's basically straight equity. And then the second option is what we call a convertible debt. So convertible debt is just an instrument which bears the characteristics of an equity holder and a debt provider. We just sort of mix the two together and come up with that instrument called the convertible debt. So that's typically the two methods in which we invest. We do not put straight debt into any company. We don't do straight debt. And so we invest anything from as little as 100,000 US dollars, and we can go up to as high as 5 to 6 million US dollars in any one given opportunity. But we cannot deploy the full 5 to 6 million at once. So what we do is we like to spread our investments, and of course, we like to give the company milestones which they should achieve, and once they achieve the certain milestones, then we're willing to follow on our investment up to a maximum of 5 million in any given opportunity. Yeah.
Thank you. I think as a parting shot, Tom or Dr. Irene, like, what did you say to innovators who are trying to work with the county government? Like, what's coming up? I know you're at the beginning of an era. Like, what's coming up in the county government to look out for? Now, if I'm an innovator looking to work with the county government, and we still have a lot of time left in this era, what's coming up in the county that we should look out for?
I thank you for that. I think now the county government is like a blank check at the moment. It's like we have everything that we need from innovation. Like we are taking everyone on board depending on the type of innovation they're coming with and the solution is bringing on board. Like as I said, I'm in charge of the food safety in the capital city. And we are looking at clear real-time solutions in terms of what we need to do in that food space. As I said, we have now innovators from World Food Program who came up with something called a brew box, which can give us a real-time solution in terms of testing mycotoxins and aflatoxins in our markets. That's real-time. We now need innovations in areas of health management information systems, as we said, so that we can track our patients. It should be end-to-end, from when they enter hospitals, when we make the referrals, when we get their tests done, everything in that space. We need a number of innovations in that area. We need innovations also, even in our mortuaries, as I said, because that is an area we have an innovator called Safari Sarama who are coming up with very good innovations in terms of what we do. And the biggest challenge we have as a county government is that we are disposing so many bodies. Because like since we came in from January, we are disposed over 450 people. Meaning we are not able to get the relatives of these people. We need innovations in terms of what we can do to identify these people so that we don't end up disposing them and they have their families. We need to get innovations on how do we equip our pharmacies? How do we ensure that we have few stockouts? These are the areas now we need to get innovations real time so they can provide real time solutions to our people. And at the end of the day, give now the real service to the Mwananchi, and in this case, people of Nairobi. Thank you.
Thank you so much. We're coming close to the end of the session, and I wonder if you have any final remarks, Aaron or Priscilla.
Like my colleagues here said, there are very many gaps and many problems in the health sector, and I think that presents very many opportunities. I would recommend that you as a business person identify a particular problem and go very hard on it and try and solve it. And I'm happy to hear that the county government is now more than happy to partner with private sector. We'll be reaching out as well to see what we can do together, and I look forward to solving the problems we have together with you. Yeah.
Thank you very much. I think as a parting shot, one is to innovators who may be thinking of or are already working in the healthcare space. I think this is one of the most exploited health space when it comes to innovation. So there's a lot of opportunities, as have been mentioned here, whether you're looking at it from data management, artificial intelligence, all those things. So the opportunities are there, and I would encourage innovators to actually join the healthcare space because we really need a lot of those solutions. Number two would be to the investors. I think you need to deploy more funds in healthcare. I think I was doing some preliminary research and I was comparing fintech and health tech, and I think the numbers are almost 10 to 1. The ratio is horrendous when you look at the amount of capital deployed into healthcare versus what's deployed into health tech. As a parting shot to government, I think would be open up the space so that innovators feel freely welcome and are able to bring their solutions to the table, and that these solutions are able to be taken up. I think because you people are the ones who also make the laws on our behalf, we need to have a mechanism that where if an innovation actually works and it's providing solution, it has impact, and it's the only solution out there, we need to have that mechanism that safeguards, this solution against the open tender process. We need such mechanisms so that we can grow not only the innovation space in Kenya, but also grow entrepreneurs who can employ people so that we create employment for as many people as we can. Thank you very much.
Thank you. Any final thoughts, Tom?
Thank you so much. I think all of us now need to look at the opportunities we have at the county government. We have done a number of research. We have a research unit in the health sector where we need real-time solutions. If all of us can interact and see exactly the number of solutions we need. As a county, we are guided by the CIDP, the County Integrated Development Plans. If there are the innovators, can go and look at the governor manifesto, look at what we have in our CIDP, in our annual work plans in respective sectors, and provide the real-time solutions. I think we'll be more than happy to accommodate them and see the best way port entities will benefit from such innovations and the real solution we are going to bring to our people. So I'm glad that we have engaged in this forum, and I'm looking forward to even more engagement from respective innovators, even directly through our offices, even through the Office of the Innovator and Startups, so that now we can advance these interactions to now real-time solutions to our people. That's what we are looking at. And now we have like all areas in the county government, we need solutions. From parking, we need to have solutions on how we park, to deal with issues of even traffic jams in the city, where and beyond. We know the problem they are bringing to even the health sector, to see how we can clean our air. We have clean air qualities and monitors in the city, so that we can have this whole spectrum of wellness, of a city of order and dignity, as the governor describes, so that all in all this can be right through technology and our efforts we put in on a daily basis. Thank you so much.
Thank you. Any final thoughts, Dr.
My parting shot, health is a fertile ground for innovation. Yeah? And when I look at, just like I said earlier, health is very dynamic. It changes, just changes. Every other minute, something new is coming up, a better solution is coming up. And we're in that space right now. So we'd like to see all these innovators and innovations coming to help us to provide solutions to our healthcare issues, and also to move in, to be in tandem with the times. We are rapidly getting into technology, much as my colleague has talked about tech not taking our jobs, but some of the jobs will actually be taken over by technology, just to create efficiency as well, and just having a robust health system. So come on board, you're very welcome. Let's make sure that our health space is good using technology. Thank you.
Thank you so much. Any final thoughts, David?
Yes, sure. Thank you. I think I'll maybe just also reiterate what Aaron said, that there's a difference between innovators and entrepreneurs. So I think from an investor perspective, I think it's to encourage both innovators and entrepreneurs approach investors, in as much as maybe you might not get the funding that you hoped you'd get. At the end of the day, such interactions, I'm pretty sure you'll end up leaving there with a lot more ideas on maybe how to tackle any issues you have. So if you can't access the money from the investor, try to access as much knowledge and information from them as possible, because it tends to be very fruitful knowledge for companies. And I think maybe to the county government, I think a parting shot would be, it would be very fantastic if we could just find a way to, engage with you guys every so often to see how maybe we can try to support both the innovators, entrepreneurs, and eventually the Nairobians at large, and ensure that as many Nairobians have jobs as much as possible. So thank you so much.
Thank you, everyone. Thank you for being in the panel today, and thank you for listening. So I'll invite my colleague to introduce the next session from here. Thank you so much.
Sure whether to stay or go. I think you're going to be our judges in our pitching competition, and I'm actually just looking for guidance whether we just keep the judges up here and have the entrepreneurs and innovators, we have both, and a good blend of both, pitch from here, and you continue to judge from here. The difficulty here is that you're going to need to be scoring and therefore writing on the... So Victor, give us some guidance as to what we should do here. Give us a couple of minutes to get set up. What should we do? Should we keep them here? It's 5 minutes per, it's about an hour. About an hour. Because they'll be, yeah, so we can focus on the entrepreneur. It's a good point. Can you hear me now?
Yes.
All right, thank you, everybody. I think while we wait for Priscilla, I will introduce what we are going to be doing in the next 45 minutes to an hour. We are very excited to be presenting some examples of some of the things that we've just heard from the panel are things that are challenges for the county government or for public health. You know, at Vilgro, we have a lot of these solutions, so we really need to talk and start working together. And I'll just highlight a couple of things. We have a big artificial intelligence portfolio at Vilgro Africa. So that is something, you know, if that is something that you're very interested in starting to take on, that is something that we can certainly help. In terms of maternal and child health, that is also another big focus of ours, both from a maternal health perspective. We have several projects, and in fact today we are going to be seeing one from a maternal health perspective that comes to us from Tanzania called Mkanda Salama. From a nutritional perspective, we do have in our portfolio a company that helps nutritionists provide food plans for people who have certain health conditions. So that is something also that that we can work with. When you talked about drones, I was hoping that the organization or the enterprise you are working with was one of our portfolio companies, Swift Labs. And if not, we do have that company in our portfolio that has actually done some malaria mapping, but I don't know if they're the ones that did the cholera mapping, but they've done malaria mapping within Nairobi County. And so on and so forth. So what I'm trying to say is that we do have a lot of these solutions for the opportunities that have been talked about by the panel. Today we are going to be looking at entrepreneurs who I'm really excited about. This is based on a call that we did looking at a gender lens perspective. So really looking at women founders and at the same time people who are looking at women's health. So it is a combination of both of those things. So you're going to hear some really amazing things, both from a maternal health perspective, but also just in general women's health. I'm now trying to kill some time to make sure that Priscilla is back before we actually start judging. But I think we are going to go ahead and get started on this. For the judges, really, the judging is or the presentations and the judging are in two parts. The first 5 or 6 companies are service companies that are already in the market, that are already doing business. So we're going to be looking at them from the lens of, how well have they understood their market, but also what traction do they have from a business perspective, how well are they doing. We're then going to have another category that has 2, which are hardware companies. These are people who have developed their own hardware. So we're going to look at them from a slightly different lens because we're going to look at how well have they developed that hardware from the perspective of the patients and healthcare providers. Have they really understood the needs there, and have they reacted to them well? And how close are they to being able to go to market? Hardware is really hard. So we are sort of putting that in its own category. Not to say that the other people that are presenting do not have any hardware components, but those 2 started from scratch and have actually developed their own devices and hardware. Okay. So if the startups can actually come closer to the front so that we can kind of do this fairly quickly, I will introduce the first startup that is going to be presenting, and we are going to try and do 5-minute presentations. This is as much a showcase as it is a competition. And I did say at the beginning that we are excited to be showcasing this as an example of the kind of work that Vilgro Africa is doing. And at the same time, it is a competition, so there is going to be some financial awards. We are going to be awarding for the first category that I talked about, which is the non-hardware, 3 prizes. One at $10,000, that would be the first prize, the second at $5,000, and the third at $3,000. For the hardware, we are going to look at the 2, and we're going to award, give a financial award of $5,000. Okay, so our first startup that is going to be presenting is Simply Me. And Eunice is going to be talking to us about prosthetics, and she's going to tell us more about that. I'm not going to steal her thunder. Welcome, Eunice.
Good morning, everyone. I'm just waiting for my slides to come up. But to begin with, my name is Eunice, and I'll be presenting a company called Simply Me that takes care of our breast cancer patients and survivors who have lost one or both of their breasts to the disease. Okay, there we go. Simply Me, as we like to call ourselves, we are the in-between of fashion and medicine. So I'd like to pose a question to you in regards to, do you know any breast cancer patients or survivors? By just a raise of hand. Okay. Can you answer the second question? Do you know where they shop for their post-mastectomy products? That's correct. That's where Simply Me comes in. You will be shocked that in 2020, 6,000 women were recorded to have experienced breast cancer. And out of those, we can say about 2,000 lost their breasts to the disease. I have spent the last 4 years of my life dedicating in answering the question, where do breast cancer patients and survivors shop for post-mastectomy products? I'm ushering a new perspective in the lingerie industry that pushes out the very sexy business model, what we know, the skimpy-looking and sexy-looking women, and instead using inclusion as well as inclusion and intimates. We are impacting East Africa, just bringing, okay, sorry. I think I'm a bit nervous. Let me just calm down. Okay, let's restart. Simply Me is ushering a fresh perspective in the lingerie industry, pushing out the very sexy business model and instead using intimates and inclusion to be impactful in East Africa. So we are not only in Kenya, because every woman deserves to be comfortable, to be complete, and to be whole again. Meet Eunice. That's me. Now I'm not nervous anymore. I experienced a single mastectomy, and I lost one of my breasts. And in that process, the biggest challenge that I experienced was getting post-mastectomy products locally. So, as a survivor, I had to look for a solution not only for myself, but for others like me. And I founded and started Simply Me. Simply Me was an attitude. You had to accept me the way I am. This is my new lifestyle. And we created a space where others could enjoy a shopping experience which was comfortable to them for this particular important part of their body. The sad reality, 92% of breast cancer survivors choose not to have reconstructive surgeries. And there is an emotional connection to the purchase of their post-mastectomy products. We are fulfilling a considerable void in a multi-billion shilling industry, quote unquote, cancer, whose these women's, their chest walls may be imperfect, but they are alive and they need to get an optimized shopping experience. I'd like to pass around the prosthesis just for a feel, for someone to know how it feels like for someone like me walking around without one. Simply Me is revolutionizing the shopping experience of women. Think of us as the Vivo, but for boobs. How many of you know Vivo? Correct. Simply Me uses inclusion. We offer 2 different kinds of breast prostheses in different sizes, because every surgery is different, and bra sizes that range to 100 sizes. And we offer intimate, a private, inclusive, and a unique shopping experience that will make our clients feel and look beautiful in their perfect fit. We started our journey by establishing a shopping experience and a fitting experience like no other, with the added benefit of our oncology fraternity. They have helped us to spread the word. Our post-COVID numbers, and those are our products. We do bras, breast prosthesis as swimwear, because everyone has a lifestyle to live. Our post-COVID numbers, 2022, 2023, we were doing at about $8,000 US, and we are looking to 2x. We are being realistic, 2x in 2023, 2024. So we are seeing our revenue going to about 17 or 18,000 Kenya shillings. We have helped 102 women currently in 2022, 2023, and we are looking to serve more. That is our business model. We have exclusive distribution with a company called Anita that manufactures in Germany. We engage our clients from the clinics to the health facilities, and then finally we distribute the product to them wherever they are within the country. We have been featured in various media outlets, and from this we received overwhelming response from survivors across the country looking for our products. This has made us become very determined in accelerating our scaling agenda with our initial market in Kenya. We are looking to open up branches at the county level, starting with the second largest medical hub in Kenya, Rift Valley, hosted by the Moi Referral Hospital in Eldoret. And the other location we are looking to open up is in our coastal region, that is Mombasa. With the funding that we are asking for, we are looking also to create a stockpile to be able to be ready for our partnerships with the treatment centers. Eldoret serves a huge market. Imagine the Rift Valley from the north of Kenya to the south of Kenya, that is Kisumu. We're not forgetting our clientele who come from our neighboring countries in East Africa, and they have reiterated to us that they need our services and our products in their country once they have returned back home after treatment. And this also has expanded our vision. And this we come to our pop-up shops. We have done a couple of rounds this year where we have just traversed the country, showcasing our products so that our potential client can first experience our fitters, and from experiencing our fitters, they can be able to experience the product and even just have someone to talk to, which we call our digital communities, bosom buddies or sisterhood. We are also looking to expand our vision with developing a digital fitting solution. And this has come to our light because everyone lives in a different area code within Kenya. Say someone in Garissa, do they have to come to Nairobi to have a fitting? We believe not. Someone in Lodwar, someone in Lonliani, somewhere in Kenya. They don't have to come to Nairobi, and that's how we will leverage digital health through virtual fittings. We started with one store that is in Nairobi, and we are looking to grow to a tech-enabled, high-margin, high-growth revolution of women seeking from an industry that has neglected them. I felt neglected when I was told, now this is your new life, both online and offline. As a constant student of entrepreneurship and retail, I have completely dedicated my life to studying the shopping patterns of breast cancer patients and survivors. National Retail has neglected breast cancer patients and survivors that we know and love. We are here to change this, and I'm asking for your help to change this. To revolutionize the way we get our post-mastectomy products, either at the clinic, either at the doctor's hospital, or even from the initial stage when we are told we are diagnosed. We are looking not only to serve our clienteles in East Africa, in Kenya, but also in East Africa, because I believe every woman should feel confident, complete, and whole again. Thank you.
Thank you very much, Eunice. I made you jump. Thank you, Eunice. As a breast cancer survivor myself, I reach out to you, and I'm very, very proud of the work that you're doing. Thank you very much.
Thank you.
All right. From Eunice and Simply Me, we're going to go to Sahar and Maziwa Pump. That is a Kenyan-based company focusing on looking at children's well-being as well as keeping women working while they're taking care of their children. Welcome, Sahar.
Hi, everyone. Good morning. My name is Sahar Jamal, and I'm the founder of Maziwa. While working at Jacaranda Health, I met a new mother named Isabel, who was dreading her return to work as a construction site worker, because to her, it meant giving up on optimal breastfeeding. Unsurprisingly, her construction sites don't have lactation rooms, so she would have to use the outhouse to express breast milk. They don't have electricity that is reliable, so she couldn't use an electrical breast pump, and she would have to use her bare hands or a slow manual pump. And even if she managed to do so, there was no refrigeration to store it. Plus, her environment was completely unsupportive, with her male colleagues chastising her for taking breaks. Like Isabel, 90% of Kenyan moms struggle to choose between staying at home to breastfeed their baby and returning to work to support their families financially. Unfortunately, staying at home and giving up on working means that they lose several months of income in the short term, and even more than that in the long term after several births. On the other hand, if they give up on breastfeeding, their baby is 14 times more likely to die because of serious illnesses like pneumonia, stunting, and diabetes, and the mother is more likely to face a risk of cancer and diabetes. To tackle this trade-off, we have launched the Wema breast pump. The Wema breast pump is discreet enough to fit underneath your clothing. It is rechargeable and wireless, so it can be used without access to an electrical plug, and it comes with a portable milk storage cooler. So Isabel was actually able to use this breast pump while she was painting a wall at her work site without any of her male colleagues noticing. Most breast pumps that are available in Kenya compromise on efficiency, discreetness, affordability, storage, and local branding. And baby formula is an expensive and inoptimal substitute for breast milk. Therefore, these alternatives only reach about 10% of Kenyan mothers. We aim to reach the remaining 90%. We do this by training and recruiting a network of community breastfeeding ambassadors who can provide hands-on lactation support through health talks and support groups. And we ask them to distribute our locally branded maternity products, all while gaining a supplementary income. Our serviceable addressable market is growing every single year as more and more women return to work and start working, and the middle class continues to grow in countries like Kenya. In Kenya alone, every single year, the new mothers who enter the market result in a $17 million opportunity for us every year, and across sub-Saharan Africa, that's $256 million every year. We reach this market in two key ways. First, by using social media and WhatsApp education to work with influencers and healthcare professionals to drive education and drive our sales through our own website and other retailers, including Maziwa. And we also work with county governments and NGOs to actually recruit and train our community breastfeeding ambassadors that can drive our rental option to rent the product monthly, as well as our corporate package for a shared pump for workplaces. So far, the results have been amazing. We have received a 14x return on marketing spend for our social media channels, and one of our TikTok videos actually received 4 million organic views and went viral, which is really exciting. On the other hand, our educational programming has received great feedback from mothers and participants, and we've also received a $250,000 non-dilutive grant to support this program. So far, we've reached over 16,000 mothers and children with our products and services. We have generated over $60,000 US in the last 12 months in revenue. And most of the mothers who we've surveyed have been able to balance working and breastfeeding as a result of the Wema breast pump. And some moms have even said it's the best breast pump in the market. Most importantly, our objective is to reduce the amount of premature infant deaths due to suboptimal breastfeeding, to reduce diseases in infants and mothers that are completely preventable, and to increase cognitive development and function and brain development amongst children who are our future of Africa, as well as encourage mothers to return to the workforce if they choose. As the founder of this business, I come with a decade of healthcare experience at companies like Johnson & Johnson, and I'm supported by a strong local cross-functional team with expertise in healthcare, as well as startup companies across Kenya. So with your help, we'd like to invest $750,000 into growing our sales and marketing, converting our part-time team to full-time, and looking at additional product offerings for our ambassadors to distribute. With this, we'll be able to impact another 200,000 mothers and babies, train another 200 ambassadors, offer multiple products to women, and generate $2.5 million in revenue, all while achieving profitability by December 2025. So as we concluded the celebration of World Breastfeeding Week just on Monday, which has had a focus on making breastfeeding at work work, we hope you will join us in this journey to ensure that no mother has to choose between her baby's health and her family's economic well-being. Thank you for your time.
Thank you very much, Sahar. Next, we are actually staying with maternal and child health, and we are going to go to Agiki from Tanzania, and Agnes is going to come and tell us about how they're improving the health of both women and children in Tanzania. Welcome, Agnes.
Hi everyone, my name is Agnes Kimweri. I'm founder and CEO at Agiki Medical Lab. The company based in Tanzania, we make accessibility of quality healthcare services, especially for pregnant women and children in rural community. I want to introduce my partner, UNFPA, Sankal, Insight, Women in Africa, and Innovate Hub in Tanzania. I want to ask you, anyone who lost a close relative, even your mother or your sister, during a pregnancy, and someone who having any abnormality caused due to lacking any diagnosis or treatment. So I don't need your answer. I'm a victim. 7 years ago, I lost my sister during a pregnancy due to preeclampsia caused by anemia. At 8 months, she lost her life and her baby. And the causative agent is the inaccessibility of quality healthcare services, especially in rural community. And when you listen to my voice, it is abnormal due to lacking early diagnosis and treatment. So this is a big problem. It needs big solution. That's what Agiki Medical Lab we do. We offer digital mobile dispenser for rural patients, especially pregnant women, children under 5 and elders, by providing affordable laboratory tests for diagnosis, mobile clinics for pregnant women and children, and free health education. So far, our service is easy to access. You can access online, offline, and physical. But for physical patients, we reach them by using them designed van, which is using solar powered and multi-purpose. It works by using electricity power and solar powered. So we are not alone on the market. We have a competitor. Our competitor, Mwenge Hospital and Religious Hospital. But competitive advantage, we're providing door-to-door services. We're reducing maternal death cases from 5 to 1 cases per month. And our solution is environment friendly. This is a business. We make money. Our business model are business to customer and business to business. We receive 10% as a commissioner from other hospitals. We charge $7 per customer. This is including the fundamental test and the treatment. Due to having a good business model, we have this result. So far, currently, we save 20,000 customers per year, which including pregnant women, children, and elders. And we generate $16,000 as a revenue per month. Also, we are reducing carbon emission, 525 kilograms per month. And so far, we are reducing maternal death cases from 5 cases to 1 case. We're asking $120,000 to cover in marketing to purchase ultrasound machine in order to safe delivery for our pregnant women, and also in training and marketing. So far, we have an impact objective by 2028. We expect it to employ 50 people, including young women, and we can increase accessibility of quality healthcare service by 80%. You can see this is a profitable business, revenue increasing and profit increasing. We expect 2022, our revenue was $192,000, and 2028 we expect to generate 10 million. I'm not alone. We as a team, energetic and passionate in medical services. By professional, I'm a laboratory technologist. We have a Happy. He is also an environmental expert. Also, we have Dr. Tieno Regina. She's my co-founder and also operation manager. So, what I need from you, I need the people who can join in my journey for partnership, grant, even investment. So, in order to save the life of people from rural community, especially pregnant women, children under 5, and elders. So, you are welcome to join my journey. This is our contact. Thank you.
Thank you very much, Agnes. And from Tanzania, we are going to take a trip to Uganda. And Goodness is going to talk to us about some of her very innovative products in the fight against malaria.
Hello, everybody. Good morning. My name is Goodness. I am a co-founder and the COO at Yuganics, Uganda. Do you know that there are more people dying of malaria every day than any specific cancer? Well, this is a quote by Bill Gates, and I'm here to validate that. Before that, I would like you to meet somebody. This is Ivoni. She's an uneducated woman in our community at Mpigi, Uganda. She has 7 dependent grandchildren, and she earns less than $30 on agriculture, which is her main source of income. My team met Ivoni in 2018 during the sensitization program at a rural hospital. And when we conversed with her, she said that was her 10th visit in just 1 month, and she spent nothing less than $4 on each visit. We asked about mosquito nets, and she said they were reserved for visitors and guests in her home. Ivoni thought her kids contracted malaria from eating unripe mangoes and drinking unboiled water. But this is not just Ivoni's story. This is the story of millions of people in Africa. This is also my story growing up. In 2001, the World Health Organization showed that over 200 million malaria cases were recorded, and 600,000 of those deaths were confirmed. Well, in the next 5 years, without a malaria intervention, over 1 billion malaria cases are expected, 400,000 deaths annually, and 70% of those deaths will be children below the age of 5. How so? Every 2 minutes, just like we've been here, a child under the age of 5 somewhere dies from malaria. Thousands of those kids die in Africa, and then 10,000 have been recorded annually in Uganda alone. Just like Ivoni, there is limited knowledge about how malaria is contracted, even in 2023. There is no proper access to quality preventive materials, and the affordable preventives like the sprays or coals have deets in them that can cause respiratory health issues and are health hazardous. The late detection has been the #1 killer, and the available solutions such as mosquito nets only offer limited protection as they're used during sleep hours. At Yuganics, we have provided an innovative technology, which each and every one of us have used here today, soaps. We produce soaps that have mosquito repellent properties in them and offer protection for a long period of time. These soaps have been tested by NDA and the Bureau of Standard in Uganda. It offers up to 6 to 10 hours of protection on just one single use. They are eco-conscious, and our packaging materials have been made with recycled papers. We have a very beautiful social business model that allows people like Ivoni to afford those products. We sell to the high tourism industry because we know that a lot of foreigners want to protect themselves from mosquito bites. So we sell to them at a slightly profit of 80%, and to the middle and high class at a profit margin of 50%, helping us cross-finance to sell at 5% to people like Ivoni, giving a customer acquisition cost of just $0.75 and a lifetime value of $582 in 5 years. We address a market of $680 million in a $6.4 billion market size, which is just 40% of eco-conscious households in sub-Saharan Africa. We are aware of our competitors, but we are at an advantage because with soaps, it can be multi-purpose. You can use it to wash your clothes and bathe. We are very affordable, as our average price range is just $1.25, and we are safe, and it's inclusive because anybody can use it, unlike sprays and deets, which people with asthma cannot use. Our go-to-market strategy is plain. We understand what we are offering, everyday products. We know who we are offering it to, the tourism, local, and urban markets. We know through the channels we can get them, the pharmacy stores, hospital, and healthcare personnel, and we can sell to them both direct and through online platforms. I'm sure you are asking how we're able to produce enough repellent plants to meet our demand. Well, we're not doing it alone. We have a segment of a women empowerment program where we train women in our communities to grow these herbs and then bring it back to us to produce the mosquito repellent soap, and in turn, we pay them. These women, in turn, benefit through capacity building, improved agricultural practices, and financial stability, to mention but a few. Like I introduced Ivoni to you, this is Ivoni now. Ivoni no longer visits the hospital 10 times a month, but on a record, she has visited 15 times in just 3 years for other cases other than malaria upon using our soaps. Ivoni earns nothing less than $75 from our Women Empowerment Program every month, and she understands malaria and how to prevent it even better. We are very, very impactful. We've reached up to 3 million people with the soaps we have been able to provide, produced locally. We have subsidized 500,000 soaps so far with our social business model. We have empowered 40 women and youth, and we have 25 plus distributors with one of the second most popular marketing platform in Uganda called Shikovo, and also Johnson & Johnson. We are not just impactful, but we are also profitable. Our financial year has grown over the years from 2018 down to the last one in 2023, and we have a projection of 2025, making us very profitable. We are asking for your support to do more. We're asking for your support to be there to save more lives, of $500,000 to finish our Women Empowerment Program, educate more people, hire more professionals into this, in both equity and grants and convertible notes as well. Our next plans is that we want to expand into the markets. We want to reach through Kenya and Rwanda as well. And we're already in a research where we're creating an MVP of a malaria test kit, RDT, that uses other body fluids except from blood, which is very convenient for people in the local communities. We also want to have a 90% user growth by 2025 with our products. I don't do this alone. I do this with a team of highly motivated individuals who are also passionate to create change. Meet Joanne, she's the CEO and founder. Myself, Goodness, a co-founder and the COO. Shafiq, who is very much interested in production and cosmetics. Catherine, our financial officer, and Charlotte, our technology officer. We have been opportune to be mentioned in news and articles, both nationally and internationally, and we've gained their support financially and through otherwise. At Yuganics, we believe that we can create change and we can save life, and you can do that together with us. Thank you.
Thank you, Goodness. Our next presenter is a gentleman. We've had all ladies all morning, and you know why this is important is because when we talk about a gender lens, we're not talking about just focusing on women, but everybody coming together to balance what we're doing from a gender perspective. So the next gentleman is Douglas, who is going to be talking about a company that looks at micro savings in the healthcare space in Uganda. Welcome, Douglas.
Hey, good morning. Is it still good morning or is it good afternoon? All right, good morning. My name is Douglas Smith. I'm the Chief Operations Officer and co-founder at Paylater Health. At Paylater Health, we believe no one should struggle financially to receive healthcare. In 2020, news went viral of an expectant mother who delivered at the health center gate because she could not afford 15 USD to get into the delivery ward. She delivered at the health center gate. And you know what happened? The baby passed on. That was very sad. That's the genesis of Paylater Health, because we believe no one should struggle financially to receive healthcare. So Paylater is a flexible, affordable, and convenient fintech, helping low-income earners prepare for and afford quality healthcare anywhere at all times through our digital healthcare micro savings platform. We are solving a very huge problem in Africa. In Africa alone, 2.8% have access to healthcare financing, leaving over 1.2 billion people without access to healthcare financing. And in Uganda alone, 0.7% have access to healthcare financing, leaving over 42 million Ugandans without access to healthcare financing. By the way, Uganda is the only country in East Africa without a national health insurance scheme. Can you imagine? Uganda is the only country in East Africa without a national health insurance scheme. Our solution. What is our solution? Peleta Health is leveraging technology. We are leveraging technology to help the uninsured low-income earners to prepare for and afford quality health care. Now, these uninsured low-income earners, they save as low as 0.2 USD cumulatively dedicated for health care. And this fund is utilized to offset their medical bills at our registered healthcare facilities and pharmacies. And we extend micro loan top-ups in case savings are not enough to cater for their medical bills. So in case the medical bill is bigger than their savings, we do a micro top-up so that they can pay later in installments. That's where the name Pay Later came from. This is how it works. Very simple process. It's a very simple process of registration, and then they start saving, and they can pay for, they can use their savings to pay to pay for their medical bills, or they can use a loan. Our value proposition. We are very affordable, very convenient, and very flexible. And we offer cheap loans and interest compared to traditional insurance companies that are inconvenient and very expensive. There is market, a very huge market. A market size of 35 billion USD, starting with Uganda with a share market of 42 million plus Ugandans without access to healthcare financing. On average, there are 5 medical visits per household member a year, costing an average of 35 USD per visit. How do we make money? We make money through revenue on cost of funds, revenue on loans, and then 1% transaction fees on facility withdrawal. Traction. What is our traction? Over 2,500 subscribers, over 150 healthcare facilities and pharmacies. We have over 25,000 USD in savings by our clients. And we have over 500 subscribers on regular saving. That is daily, weekly, or monthly. Our team, we have a team of super amazing, talented, and passionate, hardworking young people. Our founder, Dr. Mercy Ashaba, she has over 5 years experience in the healthcare industry. Myself, Dr. Smith, over 4 years experience in healthcare and business operations. McDonson is our CTO, Chief Technology Officer, over 8 years on hands-on technology and business operations, and our CFO, Emma Tracy, has over 7 years experience in accounting and loans. Competition, of course, we compete with traditional insurance companies, and as I told you, we're very convenient, we're very affordable, we're very flexible compared to traditional. We're asking for 200,000 USD in pre-seed round. This is going to help us in branding, customer engagement, product market activations, administrative and overhead costs, more lending capital. We also need 100,000 USD to finance our loan book. Thank you so much. Please, and we're introducing a USSD to help those that cannot access internet. Please, sell for health, live life without worries.
Thank you, Douglas. Now, I think you have revenue, but I think we might have missed that, and I think the panel may have missed that because it flashed on for 1 second, so you might want to let the panel know what kind of revenues you're making. Don't worry about that.
All right. We have 25,000 USD in savings, and in revenues, which is the revenues which we get from our loans, and then 1% facility, 1% on withdrawal facility is 38,000 so far. Yeah. But so far in savings, as far as it's 25 USD.
Thank you.
Thank you.
Thank you very much. Okay, the last company in this section, before we move to the hardware, is Cosmotive. I don't know whether we should have actually placed Cosmotive into the hardware category because they actually are manufacturing. I didn't think about that. But we are going to have Blandine, who is going to come and talk to us about the Cosmopad that they are making in Rwanda. Welcome.
Good morning, everyone. My name is Brandine Muziranenji. I'm the founder and CEO of Cosmotive. So when you hear Cosmotive, think about paving menstrual freedom for girls and women in Africa. So we live by this vision to see a world where every woman and every girl has access to reproductive health information and access to sustainable feminine hygiene products. And our mission is to help the most vulnerable women improve their menstrual, maternal, and child health by increasing access to products that they need for self-care. And as Cosmotive, we take passion, empathy, creativity, integrity, and tolerance as our core values. So you can ask why focusing on this. 128 million girls in Africa miss school due to the lack of awareness and the lack of affordable menstrual products. And when we looked at the solution on the market, one disposable pad is polluting our planet as 4 plastic bags. So the way we address it matters. So we bridge this gap by producing affordable, eco-friendly sanitary pads and providing an information platform. So we make our pads in different packaging. Different packaging depending on everyone's ability to afford. And our Cosmo pads are cost-effective, they are super absorbent, and they are breathable. They are made with 100% cloth that is soft, non-toxic, and it lasts for 2 years. And when you look at those 2 years, the same amount that you should spend on those 2 years can be the same amount, like for one pad, one Cosmo pad, it can be the same amount that you can spend on 100 disposable pads. So we also make an awareness initiative where we put information about difficult conversations about women's health in each package that we distribute. With Cosmo pads, we believe that no girl should miss school and no woman should miss out on life due to menstrual shame or lack of menstrual hygiene products. So when you choose to use Cosmo pads over disposable pads, you're saving 88% of your money because it's usable for 2 years. It's comfortable because it's toxic-free, and it's breathable, and it's also super absorbent. So looking at our market size, our addressable market is $1.61 billion in Africa. Our serviceable market is $640 million in Africa, and our serviceable obtainable market is 58.7% of this. And our target market so far is all menstruating girls and women aged 12 to 35 in middle and low income in Africa. So for our business, we sell to direct customers, to resellers, and as sponsorship model to organizations buying for their beneficiaries, for those who are really like under what we can call the poverty line. So when it's B2B, our price is $5 per package of 5, like the one I passed by. That lasts for 2 years. And when it's B2C, our price is $6 per package of 5. That lasts for 2 years. And we have a workshop on our platform where we also introduce subscription model. So this has been our traction to date since we introduced Cosmo pads among what we do. With our growth revenue happening last year when we had new funding for our growth production. And this year we are expecting, if we stay with the same resources that we have, we can get to 360,000 per this year. But when we get the funding that we are looking for, we will be able to get to $538,000 by this year. So this has been our progress to date. We worked with different development partners to be able to come from prototyping Cosmopads in the beginning as the first reusable sanitary pad in Rwanda, to now getting to the level where we want to get to every woman and trying to also subsidize on how they pay and also giving them a payback period that they can be able to afford. So we have been able to raise almost $600,000 since we started, and with this, we have been able to impact almost 500,000 direct impacts in Rwanda. So this is our vision for growth. As I said, if we are able to get the funding that we are looking for, that we are introducing in the end, we'll be able to get to $538,000 by this year. And our projection with assumptions that we calculated in Rwanda, East Africa, and the whole Africa, we will be able to get to almost $20 million by 2027. And with this, we will be able to distribute over 3.6 million Cosmopads package of 5 to girls and women. And we also introduced the health information and also services focusing on menstrual and pelvic care, which we expect to give like 433,000 services by 2027. And with all the information that we give out with different platforms that we use, we believe that we will be able to reach over 6.6 million individuals with our information. And looking at all the impact that we get, if we are distributing 3.6 million packages of Cosmopads, we are able to prevent the pollution from 3 billion disposable pads, which is like 12 billion plastic bags in pollution. So this is our team. I'm Blandine Muziranenge, the founder and CEO of Cosmotive. Opportune is in charge of operations and finance, and Quinto is in charge of sales and marketing. But we have a bigger team where we believe in this code, if not us, then who? If not now, then when? This is our ask to be able to reach our vision for growth. We are asking for $500,000 US, and we call upon everyone here to join us in investing in girls' education, women's health, and the planet, one part at a time. Thank you.
Thank you very much, Blandine. To the judges, we now need to switch on the sheet that we are scoring on, because we're moving to the hardware, which is further in your scoring packet. So it's a second set of scoring packets. Okay, so that was an excellent set of presentations. Thank you all very, very much. You're all doing amazing work. Moving on to the hardware companies, we have two that we're going to be looking at today, one from Tanzania, one from Uganda. We are going to start with Nura, who is going to talk to us about a very special bracelet that they are developing that is going to be very helpful for children's health. Welcome.
Good morning. My name is Nura Izath, founder at Neosafe Technologies. I'm here to present to you Autothermal, improving neonatal survival using technology. Allow me to share with you a story of Sarah, a nurse at Mbara Regional Referral Hospital in southwestern Uganda. Sarah is the only nurse available for the night shift with over 40 newborns under her care. Every night, Sarah has to move from one newborn to another to monitor temperatures, resuscitate, and administer treatment to all these newborns single-handedly. One fateful night, as Sarah was on duty, she did not notice that a newborn junior at the corner of the ward was called and needed urgent help. By the time Sarah reached Junior, Junior was now very cold and unable to breathe well. Sarah provided all the care that Junior needed, but it took so long for Junior to stabilize and he almost lost his life. Just like Junior, more than 17 million newborns develop hypothermia annually, with up to 85% occurrences in sub-Saharan Africa. In 2020 alone, hypothermia accounted for 2.4 million deaths worldwide. In fact, hypothermia remains the major cause of newborn death in developing countries like Uganda. In Uganda, more than 83,000 newborns are admitted in regional referral hospitals. And sadly, up to 85% of these newborns develop hypothermia, with half the number dying annually. Health delivery challenges like inadequate staffing and burden of work have resulted into infrequent temperature measurements, hence leading to timely thermal care to these newborns. And this is where autothermal comes in. Autothermal is a wearable continuous temperature measuring bracelet with a remote display capability. The bracelet continuously measures temperatures, shows visual alerts, and transmits to a concentrator that is physically connected to the display screen to relay measurements in form of digits, graphs, and emojis that change color and facial expression as per current temperature on the newborn. We believe that autothermal can ease the burden of work for nurses like Sarah, but importantly help to inform strategies for optimal identification and management of newborns with thermal care challenges in a newborn unit, hence improving neonatal survival as we drive towards attaining the Sustainable Development Goal 3 that aims to reduce neonatal mortalities to at least 12 deaths per 1,000 live births by year 2030. With funding of $25,000 from the Ministry of ICT, the Ugandan government, we've been able to design and carry out end-user surveys for autothermal among pediatricians, mothers, and nurses at Mbara Regional Referral Hospital. But importantly, we have also been able to iterate product development right from prototype 1 version to the current version that we have that is ready for clinical trials. We have also been able to carry out laboratory testings and in-house testings. For the laboratory testings, we have carried out an accuracy test against the gold standard from the Uganda National Bureau of Standards. And these have been our findings against the clinical classifications. Current market opportunity in Uganda alone, we target health facilities and mothers or caregivers of newborns. Health facilities alone total to over 9,000 with more than 83,000 admissions annually, while the number of newborns developed in Uganda goes beyond 4,000 annually. But it's also important to note that hypothermia is not only a problem in Uganda, but a common global finding in all other countries. Our revenue stems from direct sale, where we have the bracelets go at $12.5, both the screen and the concentrator at $277.8. The other source is licensing of our IP, intellectual property, usage fees in form of rent and commissions to parental caregivers, and subscription fees for access to our dashboard data to inform decision-making on management of newborn hypothermia. We recognize the different competitions in market, but with autothermal coming in with an added advantage of continuous temperature monitoring, bracelet detection failures, remote monitoring of multiple newborns, and the use of emojis that can be used to trigger timely interventions by even mothers in the ward. Our go-to-market strategy, we are leveraging the experience of mentors who have been in medical device development and commercialization. We are also engaging with mothers, pediatricians, and nurses who are all potential users for autothermal, as we plan to collaborate with non-government organizations and Ministry of Health to legislate the use of autothermal in newborn care practices. Our team is comprised of engineers. Myself, I'm a computer engineer by background. Medical personnel such as Dr. Stella, who understands the need for providing timely thermal care interventions to newborns. She is the pediatrician and in charge of newborn at Mbarara Regional Referral Hospital. We have Dr. Data, who has been in medical device development and clinical trials. Professor Ediger, who is a public health specialist, and he has extensive knowledge in healthcare delivery in rural communities, as well as a product designer who is serving. Our ask is $60,000 that we hope to use for clinical tests, development of a fully functioning autothermal device, and implementing our go-to-market strategy. We recognize the different competitors who have been, we recognize the different support from partners who have been with us in this journey. And in a special way, we thank Vilgro Africa for giving us an opportunity to come and present to you autothermal. Autothermal, improving neonatal survival using technology. Thank you so much for listening.
Thank you very much, Nura. And last but not least is our second gentleman in presentations today. James from Tanzania is going to come and talk to us about a solution for postpartum hemorrhaging.
Good morning. Yes, my name is James Karema. I'm the co-founder and chief executive officer of Afya Limited Company. So, Afya, this is the youth-led company, which means it is providing affordable technologies and medical devices. So our vision is to disrupt the healthcare through very emerging markets and future markets by innovating affordable technology and medical devices. So did you know that PPH is the most common cause of maternal mortality worldwide, particularly in low and middle income countries, with 470 days per 1,000 live births? So may I share you the story? As I was working as a clinician in the rural village in Tanzania, I came across Mama Nema, who had the mother who had survived the excessive bleeding immediately after delivery. So we are trying to transfer the woman from the facility, low healthcare facility to the high-level healthcare facility, which was 90 kilometers spaced away. So this mother we tied the mother with the kangas, and we were able to transfer the mother up to the referral hospital. But unfortunately, the baby did not survive because she missed the mom care. Also, the mother survived with morbidities. She stayed in the ward for until 40 days. So, as you know, that based on the trend of maternal mortality in Tanzania, postpartum hemorrhage accounts for 29% of all maternal deaths in Tanzania. And based on the regional study, it showed that postpartum hemorrhage contributes for more than 50% of all maternal deaths in Tanzania. And the solutions which are available, such as aortic compressions, balloon tamponade, and condom tamponade, these solutions require the high level of expertise, and in most of the settings in Tanzania whereby are being saved by the midwives who are in diploma level and certificate level are not able performing such solutions. So we came up with Mkanda Salama, which is the locally designed tool which has been made to stop bleeding. It works by applying pressure externally on the aorta, whereby it reduces the blood flow to the uterus, and you can able being transferring the woman from the low-level healthcare facility to the high-level healthcare facility, whereby a woman can receive further interventions and definitive management of excessive bleeding immediately after delivery. So our added value, first, it is affordable, it's non-invasive, it is being applied externally, so it reduces the risk of mother to getting maternal sepsis. It is simple to use, it requires a little bit of training. It is reusable, that means it can be used several times. It requires little training, and it is human-centered design so as to ensure it does not affect you by the user's ignorance. So, as you see, Mkanda Salama compared it to other solutions which are in the market, like uterine balloon, tamponade, and anti-shock garment. First, Mkanda Salama is simple, why others are complex. Also, it is non-invasive, why compared to uterine balloon, which is being centered invasively. Also, it requires low skills. That means can be used by low-skilled birth attendants and clinic officers. So this is the total available markets, about 340 USD million. And the sales available market in Tanzania, about 11,000 Tanzania public and private healthcare facilities. And the current facility which have been able of saving are 48 Morogoro public health facilities. So our revenue model is mainly by sales, whereby one kit is being sold at the cost of 65 USD, also by partnership and by doing licensing with the large manufacturers. So currently we have been able to save more than 1,006,000 women, and the number of facilities receiving healthcare, receiving Kanda Salama currently are 5, but planning to reach 60 by the end of November. So our recent traction, we have been the first winner in the innovation category at the Muhimbili University of Health and Allied Science, also the first winner in the national competition of Makisatu, whereby we raised about 17,000 USD. Also, we have already completed product development and the piloting, and we have already shared the results of piloting in the East African Journal of Science and Biomedi Central. Also, we have already expanded the team to 11 full-time employees and secured the partnership with the Ministry of Health, the Presidential Office, and the Commission of Science and Technology. Also, we are now finalizing the discussion with Johnson & Johnson Impact Ventures. So these are the revenue projection. By the end of 2024, we expect to have the revenue of 200K, while by the end of 2025, we expect to reach about 600K. So we have already made the proof of concepts, we have already made the product development, we have already secured the partnership, and the pilot has been made, and the results have been there. So our big opportunity is the first market mover, having a strong team, having the business personnel, having the medical personnel. Also, we are seeking funds for increasing partnership, also for research and development, expansion, and business moderation. So this is our ask, 150K, which will be used mainly for research and development, but for expansion, we extend to reach more than 100K facility by the end of 2022. Also, we expect to extend our reach to other East African countries and other Asian countries. So this is our team. I, James Karema, being a clinician, Pascal Kija with the Chief Operation Officer, Frank Israel with the Chief Strategy Officer. We also have Caroline Mwasha with the Chief Technical Officer, Piri Ndobej, Chief Financial Officer, and our Chief Marketing Officer. We have the diversity of experience, business personnel, the medical personnel, and the financial personnel. Yeah, so you can reach us via that website.
Thank you very much, James. And that is the end of our presentations. Thank you all very much. A big hand for all the entrepreneurs. All right, so I believe now we are going to need a few minutes to finalize the judging numbers, and we are going to be, where's Anne? Wilfred, we are announcing the winners right after this, right? So stay tuned for 5 minutes and we'll be announcing the winners of the competition. Thank you. So entrepreneurs, the judges may have a question or two for you for clarification. I'll just open it up. You can ask questions for specific companies.
I have a question for Simply Me. Is she there?
Eunice, question for you.
What's the average cost of the product and how frequent does the consumer have to change it?
Okay, for the breast prosthesis, the average cost of one to get it, our landing cost is about 13,000 Kenya shillings, and our retail price is about 25,000 Kenya shillings. And one prosthesis should last a patient 3 years minimum, 5 years maximum. But our also sales comes from the subsequent mastectomy support products, which we call the bras that they buy. And minimum, we encourage a client or a patient to get 3 pieces to begin with, and consecutive as they need to.
Okay, thanks.
Oh, sorry, I didn't mention about the cost for the bras. Our landing cost for our bras range between 1,500 Kenya shillings, and we have our high end that actually land at 4,000 Kenya shillings, because we are trying to serve both markets, the middle income and the high end. And our retail price for the 1,500 bra, it goes for about 3,200, and for our high end can start at about 6,200 per piece.
Thank you.
So my question also goes to simply me. There are 2 things I think I must have missed. The first one is I didn't get insights into your team. And then number 2, what would you say is the use of technology in your amazing solution?
Okay, I will start with number 2. The use of technology right now, we are finding, because of where the different clients and patients are located Kenya-wise as well as East African-wise, we are looking to develop a digital fitting solution. And that's where the use of the technology will come in. So someone can fit at the comfort of their own home, or at the comfort of a public health facility, or as well as their doctor's office. And once this fitting has been taken, they will reach us with that data, and we'll be able to supply them with the product that they need, because it's not one size fits all. And then now our team, I myself, the founder and the CEO, it was on the last slide. I think I was just messed up with my presentation. I, the founder and CEO of the company, my background is in operations and mostly remote health. And then we have our head fitter, who is called Grace Njuki. Grace Njuki has 32 years experience in fitting. She used to work for Woolworth, especially their intimates department. Once upon a time, Woolworth was the sole distributor of mastectomy products in Kenya, which they phased out because of compete with their local or their internal production products, which were their bras. And then we have our CFO, Peter. Peter Muthiora has about 13 years in finance, both public as well as private. He has been handling our finances since inception, so he knows our finances inside out, more than me at some times, which I'm embarrassed to say, but he keeps me on my toes and keeps me educated, because that's not my forte.
And do you have business development team members?
We are looking with the funding that we will get. It has been a one-man show. That has been me, doing all the operations as well as the supply chain. But I can say I've not done a shoddy job at it so far. And we are looking to develop a sales team, but we wanted to develop a team that knows what they are doing, because at the end of the day, these women are very private about their situation. They might only tell the clinicians or even the doctors, but not talk to an external party. And once a patient or a client sees their doctors, the fitting is the most sensitive bit. And that's why we want to get sales personnel at different localities as well as different counties to be able to fit these patients once we get the referral from the hospitals or the doctors.
Sorry, it's not to you, it's for pay later. Unless you have a question for her. Oh, hold on.
Thank you for that presentation. The issue is about the weight of the prosthesis. Do you consider the weight of the other breast, or how does it go? Because, okay, from the weight, it's like it's some weight. So how is that considered so that we don't disturb posture?
Once a breast cancer patient or survivor has lost one or both of their breasts, normally as a woman, we do not notice the weight on our chest because we carry our breast on a daily. So the difference you're finding that the weight is the first product that we ever introduced to the market was kind of very weighty. The average breast and our average prosthesis weighs 42% less than the natural breasts. So this is research has been done by our manufacturers and suppliers to make it lightweight. And I can attest from myself, I first used the first generation breast prosthesis, which was quite heavy. And once it's quite heavy, it cuts on the shoulder, as well as causes compression under the armpit. And this leads to a secondary condition, which is called lymphedema, accumulation of lymphatic fluid. And that one is something that I also developed along my journey. That is why I looked for a lightweight product, which I found with Anita Care in Germany.
For pay later.
Yes, please.
Thank you for your presentation. Thank you as well, simply me. I didn't thank you. How do the patients pay? Because from what I saw, you're addressing a low to middle income.
Yeah.
Are you having issues with repayments of the loans that you're giving out?
Thank you. How do our patients pay? Like I said, we are leveraging technology. So we developed digital wallets for our patients where they save their money. So when a patient goes to the hospital, if he gets sick or maybe he wants to go and buy medicine in the pharmacy, so he will go to the pharmacy, or maybe at the time of paying the medical bill, he's going to tell the facility, I have my savings on pay later, and then he will initiate the transaction, and the transaction will go straight to the facility's account. And then you talked about...
Yes, so you are using the money you've saved to pay for the services.
Yeah, the money they save, because we say savings are specifically for healthcare, nothing else. Specifically for healthcare, yeah.
Okay.
However, I think part of the question was when you give them a loan, the pay later loan, how do they pay you back?
Oh, okay, yeah. So I gave an example that the patient you may find that the medical bill is bigger than their savings, but they've been saving with us regularly. Let's take an example that maybe it's the medical bill is 200,000 Kenya shillings, and on the patient's wallet there is 15,000 Kenya shillings. So what we do is we do a top up for them, a 5K top up for them, and then they will come and pay later in installments at a given period of time. Yeah, and usually we charge only 1% interest. Yeah, 2%. Sorry, because 1% is for the interest on the annual interest on their savings. Yeah.
My question still is to you. Would you say most of your market is in the urban areas of Uganda or in the rural areas of Uganda? And the reason I'm asking is because I've seen you're mostly using, I think, an Android app to propagate the service. How does that fit in with, what they call bottom of the pyramid customers?
Yes. So we are serving both urban and rural. Like I said, traditional insurance is very, very, very expensive in Uganda and in Africa generally, because annually it's around 500 USD to 1,500 USD annually for premium insurance. Yeah. So we are targeting both the low-income earners, the middle-income earners, both in rural and urban areas. That's why you see we are coming up also with a USSD code to facilitate those that cannot access internet. Yeah.
So I have a question
yes,
on...
Yes, investor.
Yeah. So when it comes to the collection side, you said that when a patient can't afford, you pay on their behalf, and they can pay in installments.
Yeah, sure.
So do you do any sort of background check to assess whether this patient will be able to pay back in installments, or how do you determine who gets that?
Absolutely right. At the end of the day, when you come up with an idea, such a brilliant idea, the first thing you do, you start from first principles. How is this patient going to pay us back when we give our money? exactly the same question you, an investor, you're going to ask me when I come to you for funding. So that is, we're starting from first principles. So we do a KYC when, know your customer, a KYC when they are registering, which is 100% clear that we prove beyond doubt that this person is going to pay us. Yeah. So our know your customer part, we prioritize it very well. Yeah, because we know when we come to you as an investor, it's the first question you're going to ask us.
Yeah, maybe just one follow-up question on that. So I can imagine maybe there's people who won't qualify for that, and seeing that your the idea of pay later is to be very inclusive to anyone who may want to get access to healthcare but they can't get. So what happens to those that can't qualify for credit? Do you just send them away, or yeah, what happens?
Credit, as in you mean a loan?
Yeah, they treat now. So maybe if I can't qualify to get treatment now, since maybe through the KYC process you've determined.
At the moment, those who qualify for credit are those that save with us. They're registered and our users. So someone from outside who's not a user cannot come to us and say, you know, I'm bad off, a medical bill is in my neck, and no, you have to be our regular user, and then we can offer you credit. Yeah. Thank you so much, everyone.
Yeah, I have a question for you also.
Hey, okay.
Thanks for the presentation. In terms of sustainability, if you get huge numbers, can you show us how you are going to sustain that model?
Yeah. At the end of the day, money is coming to your account. You cannot pull money together and leave it there. That's why we have the chief finance officer. That's why we have investment partners. At the end of the day, we have to invest the money, yeah, so that we can get returns somewhere else. Yeah. So we as well invest the money to sustain the business. Yeah. I don't know if I answered your question.
No, I'm asking if maybe you have maybe your total population now you are dealing with approximately 20,000 people. What if you get 100,000 people? You know, the more people you get, the more you equally spend from your end, because you have to pay for their medical care or health care. How sustainable is that?
Oh, now remember, these people are saving with us, and when they're saving with us, not 200,000 people, all of them are going to fall sick at once. No, if you have 20,000 users, about 150 or about 200 or maybe about 500 are going to fall sick. Okay, that is an assumption in business that we have. Yeah, it's a risky assumption in business anyway. Yeah, so not all the 20,000 customers are going to fall sick and then say, all of you give us a loan to pay a medical bill.
Yeah, so I have one last question for Yuganics.
I thought it was me.
Oh. Hi, thanks so much for your presentation. I think I just have one question with regards to the product itself. So you mentioned you manufacture from simple home products, soaps and whatnot. The question is, how easy or difficult is it to copy your formula? And can it easily be copied by someone else who just takes up your formula?
Thank you so much. That's a really good question. It's not easy to just copy our formula because we have a trade license which we have already kept in place from the Ugandan government. Formula is not something we give out easily because we have gone through so many research both in the US and in Uganda. We are always going on research and product development, which with the fund we'll get, we are going to even invest more in that. As we have learned, there's a new there's a new malaria brand or strand that has been developed. It is in Kenya currently, and we're working right now to develop our soap to be more potent to actually fight that as well. So we are always on research and development, and our formula is not, I mean, you can, if the soap is here, you can perceive it, it smells like lemongrass, but it's not just that, but they are all natural, and it's not something that can be stolen or taken away from us easily.
Do you have a patent?
Sorry?
Patent. Do you have a patent to the formula?
Oh, yeah, we do. We do, actually. If you can maybe explain more, I don't.
A patent like that cannot be copied. The formula, the patent. Patent or patent, I don't know.
Maybe I didn't get that.
Yeah.
Yeah, it cannot be, I mean, I answered that. We are always developing. We're always changing, making sure that our recipes are something that are very potent. So yes, we do have that.
Patent, like no one can copy the formula.
I think, Priscilla, when I talk to
have a
business about
trademark.
this, they're keeping it as a trade secret. I believe that's the answer, right? That you're keeping
Yes.
it as a trade secret as opposed to a patent.
Okay, thank you very much.
All right. Feel free to ask more questions. We're just adding
Yeah, the one with the breast bump. Yes. How do we ensure that our breast milk is not contaminated? Number two, how do we ensure that mothers continue bonding even with the use of the pump?
Both very good questions, thank you. Number one, the standard of care right now for mothers is hand expression, and while that's very effective, there's a much higher chance that it's unhygienic because women are expressing using their bare hands and putting it into a cup or a bowl. We have a collection cup, so the milk goes directly into a collection cup, and then it's poured directly into a bottle, so it doesn't touch any other substance. We also teach mothers how to clean the pump so that there's no issues. Cleaning is very simple. You can just rinse it with soap and water, and then every 24 hours or 48 hours, you can boil the pump in hot water. So it doesn't require any kind of chemical or sterilizer, which means that it's completely safe and hygienic. On the bonding side, we definitely encourage mothers to directly breastfeed as much as possible, especially in the first 4 weeks where it's critical for the mother to achieve latch with her baby. So we encourage moms until the point that they have to go to work because of their responsibilities for their family financially, to continue to directly breastfeed their baby. Another thing is that both the father and the mother can bond with their baby by feeding the baby the bottle. It's not the same as direct breastfeeding, we understand that, but when the mother is away 8 hours or 10 hours per day with work, the alternative is either feeding formula or feeding some other cow's milk. So we believe that having breast milk at the very least is a good alternative. Thank you, though.
Maybe I can ask a question as we wait. Cosmotive, the one with this one. Who is your customer?
Thank you. We have different customer segments. So the first one, the one who made that start, the one who was struggling to afford other sanitary pads on the market. And when I started, it was 18% of Rwandan girls and women in Rwanda who were missing work or school because they can't afford to buy menstrual products. So when I started, it was like looking at over 2 million Rwandan girls and women. But when I kept on researching, I saw that it's 1 out of 4 girls in sub-Saharan Africa. So mostly those who really find it difficult to afford the pads are our primary customers. And that's why we keep on looking on how they can be able to afford. Because currently, as much as they are our target, we end up selling to NGOs to distribute to them. But we don't want to keep on going through NGOs to them. It's not sustainable on our side in business, and it's also not empowering on their side as the user. So our focus is on looking as much as we can so that we make those end users our kind of leading our sales. And we also do B2B, sorry. We sell to boutiques, to shops and boutiques for reselling our product, and also even other organizations that have beneficiaries, even though they are not in that angle.
So we have winners, and I think our folks had some checks.
Okay, yeah.
We are one.
So we can get one of these. So how many judges do I have? How many hours in total?
4, because there's 3 in this one and 1 hardware one. So the hardware one is Newsave. And then here we have Yuganics 1, Cosmotive 2, and Agiki 3.
Nice.
I think we have some results, but we lost Mr. Tom. So, along with the judges' scores, we had some scores from the acceleration program that we did with the folks. So we've added a few scores on top of the judges' scores. So it may be a tiny bit different, but for the most part, there's agreement on this. And at this point, I'd actually like to introduce our Vilgro Africa CEO to say a few words, and then we'll give the awards.
Thank you so much. Good afternoon all. Yeah, sorry I was held up early in the morning, but I had to come, I had to make it. And I'd like to thank our panelists and judges for your generosity with your time. I know we had only said 9 to 11, yet you've gone over and above. So let's appreciate our panel and jury. I'd also like to appreciate the entrepreneurs. Some of them flew all the way from different countries. You are the champions of this day. So again, a round of applause for them. And now, so that I don't take too much time, maybe Wamboi, we can go to the announcements.
To the good stuff. Yeah. So maybe the judges, panelists will help us to give the awards. But I will start with, so we ended up with a tie for the second runner-up. The second runner-up in the non-hardware category is a tie between two of the entrepreneurs, both dealing with maternal care, and maternal and child care, actually. And so for the second runner-up, the tie is between Maziwa and Agiki. So both Maziwa and Agiki will get $3,000. All right. Sahar and Agnes, come on stage, please. Mr. Tom, in the back. Thank you. The runner-up in this category is Cosmotive from Rwanda. And Cosmotive will get $5,000.
Yeah. Digital checks.
Thank you. And in this category, which is the non-hardware category, the winner of $7,000 goes to Yuganics. Innovate a ceremonial check for us. Yes, we need a confirmation. Okay, so I have to say, as CTO, I'm an engineer. I'm really excited about hardware. Not that I'm not excited about what everyone else is doing, but for me, this shows me how we are getting to a point where we can actually produce our own medical devices, and I'm really, really excited about this other category, where we are going to soon be producing on the African continent our own devices for use by ourselves. I'm really excited about this. Both of these devices are life-saving, potentially life-saving, so congratulations to both of you. Thank you very much. Unfortunately, there is only one award in this category, and the award of $5,000 goes to NeoSave. And that concludes our session on healthcare, the discussion and innovation and entrepreneurship in healthcare. We look forward, honestly, to really building some bridges, both in the investment area with AIC, with the county government, and we'll certainly be coming knocking on some doors. Thank you all very much for attending. Again, for your patience. We've gone way over the time. Thank you very, very much.